All right. Well, I think we can go ahead and get started. Um, I am Dawn Ellison. I think I know some of you, not all of you. I'm in the core group of Healthcare Reinvention Collaborative. Our other core members on the call today are Denise Wiseman and Jennifer Beach. Paul is in the Amazon, and I bet Wael is working today. So we're fortunate to be shining the light on the work of a couple of our network members. I'm going to introduce them here in a moment. You'll recall that our mission is to identify, connect, support, and illuminate every healthcare changemaker. And so today we get to do that with them. So let me move into our guests. We have two, as I said today. They will be given approximately 10 minutes to describe their work. And within that time, they will ask for what they need from the community and offer what they can to the community. While they're informing us about their work, please feel free to let them know what you can offer them, as well as what they might offer you in the chat. I want to be sure we have time to get to both of our guests and then to have a rich conversation with all of us. So when each guest is finished speaking, I will introduce the next guest, and we will continue until both of them have had a chance to describe their work, ask for what they need, and offer what they can. When they're both finished, I will open things up for a conversation, at which time you can ask more about their work, discuss possible collaborations, or just express appreciation for what they're doing. Marlene Seiden is a healthcare leadership consultant and coach with extensive experience spanning from clinical work as a respiratory therapist to executive roles in major healthcare organizations, including Kaiser Permanente and Emory. She specializes in service strategy, process improvement, and employee engagement with a particular focus on enhancing the care experience for patients, teams, and physicians through systemic improvements. Marlene, please tell us about your work and then ask for what you need and offer what you can.
Dawn and Denise and this great community that you've started, and it's been an honor to just spend time with you. So I want to just start with a little story. I have the heart of the healing profession and always wanted to be in the medical field, and started my career as a respiratory therapist. Before then, I actually worked in a bank for a little while and thought, well, that business community might be a great avenue for me. But I quickly learned that I really didn't care about anybody else's money but my own. But what I did care about was helping people feel better. And that brought me back to that foundation of health and healing. And as I experienced being a respiratory therapist, working with patients, I really had a great opportunity to see what the patients needed and also to see the experience of the doctors, the other teams through many different avenues, whether it was the emergency room in code situations or in intensive care, or just being at the bedside giving therapy to a patient. So many different dynamics and different needs. And then with the opportunity to be in healthcare leadership, looking at the different demands that we had there, I really got to put on a different lens of looking at how can we make this better? How can we improve things? And the patient was always my focus, looking at how do we improve the experience for the patient? And through that journey, understanding the patient needs, I also saw that the needs of the teams and the doctors were just as important, if not more important, to be able to address first. And that started my focus on the whole collaboration between the patient and the team experience, because they really go hand in hand. And so that takes me to the work that I do as the principal consultant for service quality solutions. I work with healthcare organizations and address where they are within that service dimension. And so if an organization needs someone to help them create their whole service strategy, looking at the values of the organization, the culture, and the alignment with who are the right people that match that culture and that alignment, what are the right behaviors that we need to have to create that great experience and build that whole format. That's something that I would help organizations with on the big picture of their service strategy. Another way would be looking at individual needs that the organization has. Is there a process that isn't working? Is there a problem with retention? Is there somewhere where they're getting more patient complaints. And so I can dig deep into those different areas and find out what are those barriers, what are the things that are causing those issues, and work with the teams or the patients to really uncover those barriers, to remove them, and create a process that's going to restore their ability to do the work that they want to do. And then the third area that I work in would be to help with leadership development. So help leaders with their communication skills and understanding the different communication skills of their teams. I would provide DISC consultant opportunities to be able to help them identify and understand that there are different communication styles, how to use them and apply them, and connect with others who may share a different style than they do. And I would help them with those tools and with their team with those communication styles and skills. So those are the three ways that I would support and work with organizations. And I would really appreciate what you could do for me as this community would be to connect me with individuals who are in need of any of those services in your network and community. Help me with understanding some best practices that you've seen in those different areas, and just to collaborate on those as well. I would be happy to partner with you if you are working on a project in any of those areas that you see that my support could provide value to you. And then what I can offer the community is the skills that I have with the communication coaching, the service strategy, any workshops that you would need in those different areas. I would be happy to help you with that. And then just to continue to learn and grow from each of you, that is one of the greatest pleasures of this community. I think we've got a great group of experts. So thank you for this time, and I appreciate the opportunity to share what I do.
Great. Thank you, Marlene. Sarah Stern is up next. I'll give Denise a second so she can pin Sarah. So Sarah Stern is a person who equally uses her eyes and her brains in her work, often serving as a visual design thought partner for experts conveying complex health topics. She is a health communication designer at Open Notes and was on the publishing team for Emily Peters' Artists Remaking Medicine. She has always worked from pieces of her lived experience that feel raw, including her almost 20 years living with chronic illness. Her career has been defined by finding her own story and understanding how it relates to others, then determining what can be done together to create positive change. Sarah, please tell us about your work.
Hi, everyone. Thank you, Dawn. Thank you so much for having me, Denise and Dawn and Jennifer. I'm going to be sharing a deck and talking a little bit about my design work. So I'm a health communication designer. This is a term that you may not have heard before. I'm in a niche that is very special and unique to my background and my education. I've worked with clients like AARP, Mayo Clinic, Phillips Foundation, CDC Foundation, Pew Charitable Trusts, and Harvard Medical. I'm going to talk about what it means to be a health communication designer and how I got here. So it all started with my patient story. Dawn mentioned that I've spent about 20 years as a chronic patient. I was first diagnosed at age 17, and the person who was figuring out, sifting through all the health information, having the hard task of trying to figure out what to do was my mother. And my mother had to make decisions like what medication I should be on at age 17 that I would probably be on for the rest of my life. And some of these medications I ended up going off of later, caused many side effects. And some of this decision making I didn't really take on as a minor at the time, but wonder what it would have looked like if I was looking for that information at the time. So when I did start to take on some of this burden and sifting through health information and engaging with health brands and looking at apps and trying to find the right ones that I would use, which I now think a lot about as a designer, I was about 26. I became an autoimmune patient and I started getting infusions regularly. And this on the left is a picture of my cat, Star, and one of the side effect sheets for my black box infusion. And you've probably seen side effect sheets like this before. They are tiny print, really hard to read, just made for compliance so that we know that we could die or get cancer or whatever else from this medication. And as a designer, I sort of questioned that method. I thought maybe patients should know what they're getting into. Maybe this should be designed in a way that's readable, that's understandable. And also maybe people with PhDs and people with MDs would prefer that kind of presentation as well. So I became really interested in the presentation of health communication. This is my science dictionary that I'm armed with, and lots of books and lots of learning about how to present information in a more digestible way visually. So I'm going to talk about one of my offerings at With Care Creative, which is information design. And I just define this pretty broadly. Information design typically is data visualization, infographics, which is usually the core of what I'm doing in information design, but sometimes I'm putting them in a report for people, or I'm working on them in the context of a presentation, or I'm working on social media carousels to explain something simply that is a complex health topic. So that's the kind of work I'm going to be talking through today. But I also do brand design work. I also do digital design. But I want to just narrow in on this specific service. So I work with Open Notes as a health communication designer, and Open Notes is a research institute affiliated with Harvard Medical. We study patient portal usage, older adult digital health literacy, how care partners can become proxy members of their patients' patient portals, and how that helps outcomes. And we publish a lot of papers. So my role is often sifting through these papers. And this is actually a very nicely designed paper. They're not all this beautiful, but got nice headers. It's got some visual hierarchy. So I take all this information. Oftentimes I'm working with AI, and oftentimes I'm questioning AI. What page did you find that on? To find the most salient points in the article that I can then translate for the team for PowerPoints and for social media. So this would be what a PowerPoint slide might look like. I've taken out some top hits, their top stats from this paper. There's a little bit more information underneath, and this is sort of a taste of what someone might expect from the paper, just a teaser to get people to want to read more. And that's often what I'm doing. I'm trying to attract people to a number or a fact or just a little snippet to get them interested. This is what it might look like on social media, a social media carousel. So you would slide through these slides. I'm going to show you what a report looked like for a health information exchange in Vermont, and just sort of talk you through how, as a visual designer, I would approach a data visualization to make it more readable and understandable. So this is what the client gave me. This was for their annual report. The type hierarchy, and when I say that, that means what is the header? Is it readable? Is it more noticeable than the rest of the text? How many different fonts are there? How many different sizes are there? This is kind of messy. The two graphs don't really sit well on the page together. There's a lot of different font sizes. So after, and also this donut chart on the right, it's very hard to see what is the most money, what is the second most, what is the third most. There's just a lot going on here. So when I edit it, I'm looking to create that clean, polished look that someone wants in their annual report, which is probably being read by people who care about money, and make things really polished in that way for that audience. And then this is a research paper through a content marketing agency focused on healthcare that is about plain language, which I love to talk about. So they did this study on whether plain language is preferred by people with MDs, people with PhDs, and found that it's not just patients who want plain language, it's everyone, because it's more understandable. So this is an example from that report. There's tiny, tiny letters you can't really read. There's huge ones that look kind of goofy. And you're kind of comparing the very likely and the somewhat likely, but that's not the point of what this chart is trying to say. This is trying to say that plain language is more important than not plain language. So what I'm doing is just simply looking at color, looking at type, and making it really clear that plain language is what we care about here. The warm colors come forward, everything is cleaner, polished, great for presentation. So that's the kind of work I do. I mentioned I also do brand design, happy to share more about that. And this is my website if you would like to check it out. My offer is if anyone has a figure or a diagram that they're working on for a paper, a book, an article, I'm happy to take a look at it and tell you how I would make it more clean and polished and ready for publication. And my ask is just to share my website around with someone that you think might need design help in the health sector. Thank you.
Great. Thank you, Sarah. Thank you both. I really appreciate the work that you're doing and that you're willing to be here today and share it with us. Now I want to welcome everyone to open your mic if you would like to ask more questions about anyone's work, express appreciation for their work, or ask for what you need and offer what you can to spark collaborations. I'll just see who has something they would like to add.
Marlene has her hand raised.
All right, Marlene.
I just wanted to say thank you, Sarah. And it is just so impressive to be able to share information in that visual way that makes it easy to understand and read. Just that's so powerful. So that's a great skill. Thanks.
Sharon, looks like you're raising your hand. We want to unmute you.
Yes, hello. Sarah, thank you so much. Of course, I know you very well, so I absolutely enjoyed your presentation. Getting to know you, and what you're working on more deeply is wonderful. I took lots of notes on both presentations. I love women entrepreneurs and I support women entrepreneurs in everything I do. So I will gladly spread the word in every circle that I'm in. I belong to like 5 disability organizations. So I am happy to support that. But I also wanted to mention my background is leadership, and I study human resources as well, so company cultures and leadership. I am also an AI expert, so I can also offer those services as well. Marlene, I think that that's more appealing to your background, perhaps. So if you wanted to collaborate, I'm happy to do so.
Excellent. That's what we love to hear.
Yeah. Marlene, you mentioned that you're skilled in DISC. Can you describe a little bit about what DISC is and the value of doing that assessment?
Sure. Thanks for asking, Denise. So DISC is a personality communication style assessment, and there's a lot of different assessments, Myers-Briggs and others. And so DISC is another variety that looks at some different aspects. And it really helps people understand where their communication style is and the differences between the way they see the world and the way they communicate. So like a D could be a very directive kind of personality style. I would be influencing, S would be steady, and C would be more analytical and logical. And so everybody approaches life in a different way. And there's also combinations of communication styles. So it's not always just one area. And so understanding how people are kind of set up to communicate helps you understand even nonverbal cues. So you walk in a room or you walk in an elevator, and you can really tell by somebody's body language and even how they're interacting as they get on an elevator. You can get a sense of their communication style. And it really helps you appeal to that when you're trying to speak with somebody and understand them. And so providing that assessment and teaching that background to others is a great way to build relationships and good communication with each other.
I love that.
Thank you.
And often I think those personality assessments will find sort of complementary styles, right? Sometimes you think of them as opposite styles, but I think it's important for people to recognize they might be complementary. And so if you are more of a supporting style person and you work with more of a direct person, considering those complementary will get you further than considering them opposite, if that makes sense to people, right?
Oh,
I
yes.
see that
And
resonates.
yes, and it's so important that as you're a leader and you look at building your team,
Mhm.
you want to have variety of all those different personality styles to really complement each other, as you said, Dawn.
Mhm.
Absolutely.
Absolutely. Yeah.
I see Susie's hands up.
Susie.
Hi there, Sarah. My name is Susie Hun, and I'm a learning strategist. So I was over here cheering you on with everything you said about the importance of plain language and data viz. So I'm impressed by what you do, and I just wanted to offer up that for my newsletter, I'd be happy to feature you if you're interested. I started a series called Learning Led Change, because I believe that learning design is a tool for change, and you seem like a perfect example of someone to feature. So if you'd like, I'd be happy to. I can do that very quickly. The very short interview gives me enough info that I could write about you. So chat later if you'd like.
That's awesome. I'll send my email to everyone, including you. And I'm
Great.
happy to-
Awesome.
And Susie has a great
Love
network.
to see this. Love to see this happening. Great. Sharon, go ahead.
I just wanted to mention to Sarah, I not only spent 15 years in hospitality, I used to be a general manager for Marriott Hotels. I ran the sales office for New York City, all the big events for Marriott Hotels, and I was the first female lead general manager. I also managed the team that came out of the World Trade Center bombing, so they were my sales team, and so that's very important, because I think, you have to lead with authenticity, and you have to lead with integrity at all times. And your team has to absolutely believe in you and, trust that you're going to take them through any type of crisis and, support their career. And, I've taken lifeguard. She opened the Courtyard Midtown East in New York City as the general manager. I had a front desk clerk that replaced me as a general manager. So I believe in people. I believe in taking them, beyond their potential, beyond their dreams, beyond anything that they've ever even imagined for themselves. So that is where I come from. But I wanted to mention to Sarah, after spending 15 years in hospitality and believing, I kind of had learned everything about serving guests, I went into the pharmaceutical industry purposely because I believed I wanted to serve patients thereafter. And Sarah is absolutely on the right track because we did sell from the package insert, is what she was talking about when she was mentioning, the paper that comes with all of your medications.
Mhm.
Okay. And so many patients don't realize the value of that piece of paper. There is so much information in there that every time you take a medication, you really should take a look at that. Because there is so much valuable information in there, your side effects, your half-life of your medications, how they interact with each other, your contraindications, all those types of things are so important. And I'll be honest with you, a lot of the physicians don't even realize it. They don't even realize, the contraindications of other medications you might be taking. So you have to be so informed about your own health care. And I really believe that that's, what Sarah is trying to do in her efforts. So I just am so pleased to be working alongside Sarah. And, we met a while back, but yeah, she's so wonderful. And I just absolutely support her in everything she does. So just wanted to throw that out there. Thank you.
Thank you, Sharon. Rachel, you've got your hand up.
Yeah, so I had a question for Sarah. This is beautiful work. I'm so glad you're doing it. I wanted to know, how do you figure out what is plain language and like what is the translation from the medical vocabulary that still captures the main points?
That's a great question. So I'm often partnered with copywriters and with messaging oriented folks. So a lot of the language is usually coming from someone else, but I like to partner with people who emphasize plain language because I think that's what I'm doing on the graphic design end as well. Plain language to me, from a design angle, is what makes text readable. Like, is it the right size? Is it the right weight? How is it balanced on the page? What's highlighted? What's important? What's less important? Those are the kind of decisions I'm making. So oftentimes I'm doing a little bit of both. And there, plain language, there's reading grade levels. There's folks who are more skilled in this than I am. But it's really interesting watching from the Open Notes perspective how AI is developing. We recently released a paper that found people preferred often incorrect or inaccurate AI explanations of their diagnosis versus the doctor's explanations, because often the doctors don't have much time to write it. There's spelling mistakes. It's not ordered in a way that makes sense. It's not at the right grade level. And once you tag something as a doctor, people want the doctor's option. But if they don't know and it's written in a plain language way, it's written in a way that people understand, they're going to prefer the AI option. So that tells me a lot about where some of this plain language stuff is headed. And I think we're at a really important point right now where humans also have to be involved in what's important, what's being highlighted, what is coming forward.
Sure. I really hadn't thought about plain language as the visual aspect of language. And I love to be challenged and to think beyond like the whatever boundaries I had before. Because I often thought about that as more the vocabulary used and the wording. But there's also a visual appeal and sort of like persuasive writing even that we would need to consider. I feel a little overwhelmed because this feels hard enough to do what I already do.
Yeah, I mean, and I'm sure you've seen bad design from your plain language. And if the design is bad, it's not legible, people don't understand it, the wrong things are coming forward. That's also gonna plain language.
Oh, thank you so much for what you're doing.
Absolutely.
Marlene has her hand up.
Hi, Sharon. I was intrigued by hearing your background in hospitality, and that's one of the areas that I see a lot of synergy with healthcare, and I bring a lot of the hospitality principles into the healthcare delivery. And it's interesting how you've taken those into your pharmacy journey as well. So thanks for bringing that up.
Oh, my pleasure, Marlene. I spent a lot of time. I have to tell you, I went right into it while I was in college, and they actually Marriott offered me a general manager in training program position while I was a senior in college. So I was really excited to start with them, and so I started in that position, and I became a general manager by the age of 26. So I was really excited, and yeah, second female in the Northeast region. So I was really proud. of myself for accomplishing that. And it's a tough job, I have to be honest with you, because it's 24/7. But really, I'm proud of myself, my team. They did an amazing job. And yeah, we became the training hotel for the Northeast region. So I trained a lot of associates, I trained a lot of general managers, and yes, I took it very seriously and I really loved it. I really, really did. It's just the only reason I left was the fact that it was a 2-hour commute from where I live now into New York City every day. So that became challenging. But after 9/11, a lot of New York City managers quit because they became fearful. So that's why I was asked to go to New York City. So
Fascinating, but it's great. It's 24/7, just as healthcare. And yeah, a lot of parallels with how do you provide great service and care and the kind of people that you need to look for and build and the leadership. So yeah, that's great.
thank you.
Marlene, I actually had a question for you. With all the work that you've done, and my background in patient experience, there are quote unquote best practices, but I feel that it's rare that something can be prescriptive and placed into a certain organization, just as it was in a prior organization. I'm curious how you go about bringing in best practices and working with those that your clients in order to identify what it is they need and how then to move forward with the work that you'll be doing in consulting and guiding them.
Yes, that's a great question, Denise. And it brings me back to a recent experience that I've had. I've had the honor of being trained with the Sterling Institute, which is a Baldrige group for Georgia and Florida. And one of the key foundations with that, with performance excellence, is understanding the goals of the organization. And so that would be the first step. What is important to you, Hospital X? What are your values? What is your culture? And based on that, then I would look at best practices in the areas that are compatible with what's important to them. And that's really important because I would never want to go in and make assumptions. And so really understanding what's important to them first is the first step.
So it just
Does that
occurred.
go ahead?
I was just going to say, it just occurred to me that it would be an interesting collaboration to have Marlene and Sarah both go into a dysfunctional department, dysfunctional, you name it, right? And sort of graphically show the current state of affairs, and then graphically show a transformation to, what the goal is for that department, division, whatever. Wouldn't that be interesting? So
The
people
org
could
chart.
see where they're, not so much the org chart, but yeah, the operational chart maybe, how
Well,
things
that's a
actually work.
fabulous, fabulous idea. Sarah, we could be a dynamic duo with that because the things that would be uncovered would need to be presented graphically to them in a way that they understand that. And that would be so important. Great idea, Dawn.
Yeah.
A dashboard that might actually be meaningful and understood and used.
Yeah. Sort of a vision board, right?
Yeah. Spaghetti
you
maps, the
both-
whole thing.
Right. Yeah. It could be about workflow. It depends on, what they're working on. You're both really making healthcare more human-centered, I think. And I'm wondering where you see the biggest opportunities for improvement now with respect to being human-centered. And I'm just going to start with Sarah.
Yeah, I mean, this is the big question. And I've sort of carried around this tagline of humanizing healthcare as a designer for a bit. I think that brand actually has an interesting role to play, and we've seen like a lot of sort of digital health tech startups, looking to make themselves more a consumer-facing brand, and thinking of patients as consumers and thinking of other apps that they're looking at and what they're comparing things to, and not just comparing things within the health system and within the health sector. I'm thinking of like Tia, that has just this fabulous brand. It's a women's health focused startup, and there's a lot of interesting things happening that aren't blue and iPad pictures from stock photos with doctors. And I think it makes a really big difference in your relationship to a healthcare space. There's a startup called Uptiv Health, which is infusion focused, that I've worked with a little bit, and they are creating like a spa-like experience for people, which is kind of what infusions could feel like if you were to think about the room that you're in and, what you like, how you're oriented to other patients. They have like both private rooms and collective rooms where you can kind of hang out, like community rooms. Like I've always felt interested in that because I'm like, oh, I don't really have at first now I have tons of chronically ill friends, but at first I didn't really know anyone else who had a chronic illness. And I would see people, some of them were my age, and I thought I was like the only 20 something with an autoimmune disorder, and I would want to talk to them, but that's not really encouraged. So they've thought of a lot of things like that, and also bringing in sort of forest backgrounds and like some of the sort of it's not biomimicry, but that sort of calming effect in terms of interior design, which is sort of a little bit beyond what I do, but it's all within the same world of, visuals can really make a difference in how you relate to a place and to a brand.
Yeah, fascinating. Marlene, you want to take a stab at that?
Yes, the environment is key. It's all part of the whole experience. And Sarah, I agree with that. So if we add on the other dimension on the people and the interaction, I look at both the staff and the patient. And so for the human interaction on the staff side, it's linking them to their purpose. So do they have a heart for healing and for helping others? And those are the people who are really going to thrive in this environment, and then to really be able to help them stay within their purpose and foster that and continue to grow and develop. Then on the patient side, really understanding what matters most to them and what support do they need, and really addressing that in that interaction. And if that human connection is important to them and they want somebody that'll listen to them and address their questions, or do they just need a peaceful environment and don't want to talk, just give me my care. It's understanding what's important to them. And so that's where the human interaction goes. But it takes a lot of understanding and applying those different questions and values. Dawn and Denise and Rachel and others who have been in this field, does that sound right? Or do you have other ideas?
Marlene, I want to jump in and say that sounds exactly right. I have some instructions for different treatments that I've typed up over the years, but I'll often edit them for each individual person. Just earlier today, I had somebody who has epilepsy, and we were talking about some medications and some that might provoke epilepsy, and that's a whole different playing field if you already have epilepsy or might provoke a seizure. And so I had the conversation about how much does that matter to you? How should we rank that among the algorithm? Because I've seen people have varying, going from like a seizure would be the worst thing to I deal with this already. Like I'd really rather not gain weight.
Yeah, and unless
I
you
have
ask
some
those
people
questions,
who tell me I really don't want to hear a lot about the side effects because I'll talk myself into them, and they have good insight about themselves, and so they'd rather like have limited information, only what's really necessary. And if things come up, they just ask me, "Hey, could this be a side effect?" And I could say yes or no.
thank you.
It seems to be related. Yeah, go ahead, Sharon.
I was just going to say what always amazed me when I went into pharmaceuticals was how easily persuasive the doctors were about writing certain medications. That actually blew my mind. They were easily persuaded, and that actually
to write, but like persuaded by the pharmaceutical reps.
Yeah, and that actually was the reason I left the business, because I couldn't stand in my own integrity, in that industry because of that reason, I mean, if it was simply just bring them lunch every Wednesday, that seemed to work. And I was just like, that just didn't suit me at all.
And from the inside, I didn't see that, at least not amongst my colleagues.
Yeah.
They weren't persuaded.
It was
They might
interesting.
take lunch, but
Yeah, no, but it was
they
very
did their own research,
It was interesting to me because, we called on the top 100, specialized doctors too in my area. And I had five drugs in my bag. So that really was, troubling to me. And I'm right outside of the city. So, that just deeply disturbed me. And, even now I keep in my mind, who does that and who doesn't, you know what I mean? So, and I've had terrible experiences at my community hospital. I mean, I told one doctor after having a torn meniscus, I have an infection. He kept telling me, no, that's your complex regional pain syndrome. I kept telling him, no, it's not. No, it's not. Well, guess what? That infection ate my entire knee, and I had to have a knee replacement. So he didn't listen to me. After surgery, doctor moved the catheter over for my my pump that I had. It gathered all the pre-alt at the bottom of the catheter, shot to my brain 24 hours later, and I suffered a drug overdose. And the community hospital could not help me. They had no idea how to deal with the pump. They had no idea how to help me with the drug overdose. Thankfully, my doctor in Philadelphia, who was the expert, got on the phone and saved my life. But I mean, these are some serious, serious things. And, now, fortunately, I've found doctors in New York City that can support me. And, I actually run my own Instagram channel so I can reach out to patients who have complex regional pain syndrome. And I speak to patients all over the world for that reason. I follow doctors who perform the studies, and I actually bring them back to my doctors at the Hospital for Special Surgeries, and the doctor at Langone who put in my stimulator now, and I bring them everything. And I say, I bring this, and they know it. I type to them on the patient portal. I said, this study just came out. Here's where I saw it. You know what I mean? I keep them well informed because I don't only want to save my own life, but I'd like to help other patients from going through the same thing.
Yeah, thank you for the work you're doing.
It's so important.
Absolutely. Mm-hmm.
I was going to make a comment in regards to the susceptibility of physicians based on the pharmaceutical reps coming by. I think that is why the reps go by, is that they do get business by doing so. And so they would not do that and buy lunch and do other things if it did not pay off for them.
Yeah, and most of the facilities I've worked in the last 15 years don't allow them.
I'd like to play a little bit of devil's advocate, although I have not dealt a lot with pharmaceutical reps because the place where I worked did not allow them. But when I come to learn about new medications, like I will do my own research, but generally I might look at that as like a new tool in the toolbox to use and throw into the mix. And I think a lot of it is in like how I explain that to patients and try to set expectations for them and collaborate with them, and like which is sometimes includes, I've never prescribed this medication. This is new. There may be things that I don't know about it that people know. There may be things that we just don't know because it'll come out after years. And that will be part of the treatment planning. And I'm allowing the patient to use that to decide on their own. It's like, do I want to take that risk? And sometimes people have tried a lot of things and they're feeling rather desperate and they want to have an option, even if there's higher risk.
Yes, for sure. Doctor, where do I find you?
I'm in
You're
Ohio.
so wonderful. That's exactly what I would expect of my doctor. So thank you so much. That's wonderful. That's exactly the type of dialogue I would love to have with my doctor. Also, what I've come to learn is that a lot of doctors don't have a lot of training in pain management, which is so surprising to me. So that's another, avenue that I continue to learn a lot about and continue to share.
Sharon, you and I should connect. I'd love to hear some of your thoughts about managing pain management. I'm a psychiatrist, so that certainly is part of my day-to-day. I don't usually prescribe opioid medications or do things that might be, I don't have all of the tools in the pain management panel, but it is part of what I do.
Okay.
Yeah. And what you're really hearing is a shift to shared decision-making with physicians. And it's interesting to me because I first heard about shared decision-making back in like 2005. And yet we're really just starting to shift to that. And there were even, tools that physicians could use to help them share decision-making with patients back then. But it's just it's a slow culture change for sure.
And going back to the personality styles with patients, like we heard, some patients are going to say, you just tell me what you think and I'll do it. And other people want to share in that decision with you. Yeah.
Right.
Yeah. I think delegating some of the choice making is collaborative shared decision making. They're telling you, this is how I'd like to do it. This is the playground. And we take it from there.
Yeah.
Yeah. All right. Well, I think we should move into our next piece here. Thanks everybody for joining us for this event today. This has just been a rich conversation, and really, the radical collaboration that we're dedicated to. We're about to jump into network conversations where you'll be given an opportunity for small group conversations with others on the call. But before we do that, there's a bit of housekeeping to do. So if you would like to connect with any of our guests or anyone else on the call, besides, sharing LinkedIn, reach out on the HRC platform. We encourage you to take advantage of the growing community that we have there. The next Shine a Light event is on September 23rd. If you're an active network member, we're looking for more folks to shine a light on. So please let us know of your interest. We're booking into 2026 now.
I just want to share a really cool shared decision-making piece of graphic design.
Cool.
They're like conversation cards. And like this shows a storyboard of how they're used. So it's the patient and the clinician sort of sharing them and looking at them together. And I thought people would
Excellent.
Yes.
What book is that, Sarah?
So this is in Health Design Thinking, which was written by my professor at MICA, Maryland Institute College of Art, called Ellen Lupton. And I later was also involved with Banku, but this is a really cool book, and there's a couple
Cool.
of editions of it. Yeah.
Excellent.
Thank you for sharing that.